Hi, my name's Tracy. I was diagnosed at 4 months postpartum on November 15th, 2021, with stage 1B breast cancer. Following my treatment for breast cancer, I was diagnosed nearly a year to the day later on October 26, 2022, with stage 2 tongue cancer. I completed radiation in March 2023, and I still live with the impacts of both of these cancers, and I'm on maintenance treatment protocols. I was first introduced to my oncology dentist prior to starting my radiation for tongue cancer. Um, and I have seen since there, I've seen their office since about every 3 to 4 months routinely. It's really important to me to see my oncology dentist for a lot of reasons. Generally, prior to my diagnosis, I always had made dental health a priority for my health. And particularly as people age, even without cancer, there's a lot of need for dental health. So now couple that with the impacts of cancer, I have experienced a lot of changes. Radiation in general has impacted my teeth. It's impacted my jaw bones. It has impacted my throat. And so my oncology dentist is really another great check for recurrence and catching it early, because we know that that's the best outcome for head and neck cancers. Also, I'm on a lot of different medications, and regardless of whether it's related to cancer or not related to cancer, the medications that we take really can impact our oral health. And so it's really important to see my oncology dentist for that reason as well. The radiation has caused some shifting in my teeth, and eating specific foods can really be a challenge for me. So I always have things that are sort of popping up all the time. I'm a lot more sensitive and have different reactions to certain foods. It's taken me a while to get a feel for what works for me and what doesn't. And even with my speech, I've seen a speech therapist, but there are times where even just talking, I can bite my tongue. And because I am numb on part of my tongue because of the graft and reconstruction I have had, that's something that you can do pretty easily. In addition, radiation has impacted my saliva glands. And so that means that my mouth is really dry. And because of the limited movement in my tongue from radiation and from the reconstruction of the graft, it's a lot harder to move food around. It's not quite the same as it used to be able to clear food out of your mouth, and you don't realize how much of that you take for granted until after the fact. So now I notice, especially with certain foods, that foods get caught in my teeth or under my tongue below my graft, and it's really difficult for me to notice that. So I have to pay very close attention to my oral health. And so not being able to clear the food out is really a problem, because you don't want that food sitting in your mouth or in between your teeth and causing cavities. Seeing my oncology dentist is really important, because if I get something like a cavity, or I need a dental surgery, or I need a root canal, like so many of us have gone through and experienced, no matter how far you are out from radiation or from cancer treatment, it can be pretty detrimental to someone who has had head and neck radiation, as well as surgery and reconstruction. So, my oncology dentist has a lot of special knowledge and helps to ensure that I don't have further impacts to my mouth or my health given my cancer history, and really knows how to respond to those things appropriately. So, do I have any advice for cancer survivors related to dental care? Absolutely. So, a lot of things that I have learned are that regular checkups are important, and that comes from a great place of privilege. Oncology dentists are difficult to find. I'm lucky to live in an area where I can access one relatively easily. Um, and also, this is not something that is covered by your basic dental insurance. It's out of network. And so, my frequent visits are not covered by insurance and can cost a lot of money to maintain my dental health. And it is just really important to prioritize that because your oral health is connected to your overall physical well being as well. So I do make sure to go in for regular checkups in the protocol that they've set for me, which is every 3 to 4 months right now. I do use a prescription based toothpaste that helps reduce my risk for cavities. I also, under their guidance, use a very different kind of floss or picks to help get the food out of my mouth better. The floss that I use is a little bit thicker than the typical floss that a lot of people use. I know a lot of people can also use water picks just to make sure that after every time that I eat, I have a snack, I have lunch, brushing my teeth after that meal to make sure my mouth is as cleaned out as possible. Um, it also took a while mentally for me to sort of take a leap. But I was really encouraged by a physical therapist to look around and feel inside my mouth with my hands and just feel my tongue. And that's really how to notice if there's any changes or lumps or bumps and differences in your mouth. And going to your dental oncologist is really helpful in just having another set of eyes and preventing recurrence to catch any recurrence early. Um, Another thing I had done that had worked well was using things like biotin, since my saliva glands are very limited now from radiation. I try to do a lot to stimulate saliva as much as I can under the guidance of my speech therapist. I've done things like try sour candies to get your mouth to water a little bit. So I often will do a lot of that to keep, trying different foods, different things in my mouth so that my mouth gets used to more of how I ate prior to this cancer. Um, the other thing is when I first visited my oncology dentist prior to my reconstruction surgery and radiation, they gave me a lot of different exercises to do to continue to move my jaw and move my mouth. It's very easy following radiation for your bone structure to deteriorate and you to get very tight in your mouth and in your jaw. And so these really help to keep that mobility. And I do think it had helped improved my speech and my ability to eat was really just keeping up with these exercises. They seem so silly and it's very uncomfortable at first. And prior to my radiation, I thought that it was a silly thing to share, and I quickly learned how important it was to do immediately after radiation, as well as to keep doing on a regular basis. So I have found time to just do that when I can. Sometimes that's right before I brush my teeth. Sometimes it's even just in the shower. The other thing I would say is just be kind to yourself. the pain that I face is pretty chronic, and it will come and go depending on different foods that I eat or how much talking I do. Things fluctuate constantly. And so, just having a little bit of grace, I think, has been something that's been really important for me. And as I had shared earlier, this is something that is out of pocket for head and neck survivors. And we face a lot of impacts to our oral health because of the medical issue. And having access to an oncology dentist nearby and having that within reach and affordability is just so critical. So, anything that you can do to advocate for yourself and others on any level for change in this area is very critical.